It has been top of mind for a couple months now. If someone goes into cardiac arrest, are you ready to help them while you wait for first responders to arrive? Tony Sposeto is here. So your department, one of the best in the country for cardiac response and recovery. Really, though, you want to educate the public because every second counts. I mean, when we saw what happened with Damar Hamlin on the football field, it was like the nation, we all held our breaths. Yeah, and I think that, for us, it's important to get the message out that we're doing a lot, in the pre-hospital setting, meaning emergency medical services, to do what we can to try to increase the survivability rate of these types of patients. But we really need the public's help to do bystander CPR prior to us arriving on scene. And that's kind of what the message is that we want to send today to folks out there, is that it doesn't have to be a scary thing to do, and it can be very simple. But in 4 to 6 minutes, when a person goes into cardiac arrest, they can start to experience brain death. Right. And so with the average response times in the country for EMS providers getting there being about 8 to 10 minutes, we're already kind of behind the 8 ball. So if they can do that prior to us getting there, it's going to double or triple that patient's chance of survival. And you say just keep it simple because, it could be easy to forget everything you learned when that moment happens and you see somebody in front of you in a crisis. So absolutely. Walk me through game plan. Yeah, so the first thing that you would want to do is just determine that that person is actually unconscious. So, just simply tapping them, saying, are you okay, are you okay? And if you get no movement from that patient and it doesn't appear that they're breathing, really it's just a matter of locking 2 hands together like this, and you're going to use the heel of your bottom hand right in the center of the chest. There's a sternum or a bone that goes right down the center there. You want to just be right there, and you're going to start pushing hard and fast on that patient's chest. So we want to try to get about 2 inches deep on the chest, and you want to push hard and fast. They say at a rate of 100 to 120 times per minute. But I think keeping the numbers out of there is probably easier. So just push hard and fast, and you just do that continuously until EMS or first responders arrive. Now, obviously, it's important to obtain an AED or an automatic external defibrillator if there is one available, and it's hugely important to call 911 early, so that you can have them on the way. This is hard if it's just you and that person. You got to be multitasking, and I guess keeping it simple. What are some mistakes people make? Sure. So some of the mistakes that are easy to make is forgetting to call 911. So you start doing chest compressions, and maybe you had forgot to do that. If it is an adult patient and you don't have a phone next to you, you can do 2 minutes of CPR first, just chest compressions, and then go get the phone to call 911. But if you have somebody else there, it's easier, or it's better just to call as early as possible. So, if you have your cell phone there, you can put that on speakerphone, and the dispatchers are trained to walk you through hands-only CPR. And I think that's important to mention as well, is that you no longer have to give mouth-to-mouth breathing to these patients. You can just do the chest compressions. So, and it's your palm. You get it right in that divot. And you need to press hard. So it's probably going to feel kind of a little jarring because you don't want to hurt them. Right. So, and I think the important thing to remember is that, this sounds kind of morbid, but the person is clinically dead. So, they're not going to feel any of that pain. So if you do break a rib or something like that, while it is kind of disheartening when that happens, you just got to keep going. It's an emergency. I mean, it could be life or death. So it is, a couple broken bones. So that is typical to happen if you're doing that. Can happen as well. So you have to just keep your head on straight and just know that this might be their only chance. And the dispatchers are trained to try to help keep you calm during that circumstance. So if you can have them on speaker, it's like having them right there next to you. So make the call first. Make sure to call 911 because that's going to be your support, not just over the phone, but they're going to get there eventually. Right. I can see how that'd be easy to forget to call because it's just like the panic of what's happening with this person. And while we're going to stress the importance of getting a formal class for CPR, You don't have to have a formal class to do this. Yeah, you can watch videos online, but also get in touch with your local fire department and, you know, reach out for help, guidance. Right, absolutely. Thank you so much for being here today. Thank you. Really interesting. We all became painfully aware that a lot of us, just even in the workplace, we don't trained on CPR. So thank you so much.
Yeah, thank you.
We're gonna